Advancing knowledge and skills in support of our mission and vision through improving competencies, learning new ways of doing things, and sharing that knowledge with others are just a few of the ways the value of learn is demonstrated. The Team-Based Care Planning Team has been outstanding in its commitment to learning, which is why the team is this year's Values in Practice Team Award winner for Learn. The work of this team started in 2012 with a desire to improve patient care and reduce provider burnout. As they learned about the options, they launched a pilot project in team-based care. It was a small start that's resulting in some big changes throughout the Bellin system.
A group of us administrators along with key physicians came together around the table to really talk about the current state of how we're caring for patients and also what is happening with our providers. From there, we formed our planning team and have been meeting every Monday in the afternoons, trying to develop what really is a win for the patient, win for the care team, and win for the system.
They went and they researched team-based care in different parts of the United States, and they found some models that they liked. And they came back to Bellin and they actually took some of those ideas from the models, but they actually enhanced them. What they did is they started with a prototype in Dr. Jerzak's office.
Well, the first thing with any project like this is to get used to change, because change is really a big part of this whole thing. So in the old system, I would go in a room and get in a computer and be focused on the computer and trying to talk to the patient and yet do all the documentation and order entry in the computer. So the office visit redesign had a greatly enhanced role of the medical assistants and the LPNs. So they do a lot of expanded rooming techniques and do a lot of work on care gap closures. And then they stay in the room with the visit and they talk about, they do the documentation and the order entry. We wonder how patients would accept that with another person in the room. And I think the first patient we saw back in November 14 commented how nice it was that I was able to focus on them. So it was really cool right off the bat.
The team-based care team approached this as a cultural transformation, not just a technical change, and I think that made a big difference in it being successful. There are many places in the United States who have not been able to do this. They've been able to do it with just a few practices. We actually have team-based care implemented in 40 different practices, and we have 40 more that are on deck this year.
The results so far have been just astronomical, from quality measures that we have on our scorecard today for the health and well-being of our patients. Seeing the improvement in specific quality measures has been very eye-opening for us, and the workflows that have been created, and also the development of the staff.
We've had a lot of requests for groups to come and observe our processes because of our reputation, I guess, that we're getting out there nationally. Really, I think it's been a culture of innovation that Bellin's had, and I think that comes from the top.
I truly would like to thank Ann Hale and Pete Knox for nominating our team for the Learn category, and also to be part of this team. The planning team is very dedicated, and I'm truly honored to be part of this team and the dedication that has put forth for Bellin.
I'd like to say congratulations to the original team-based care planning team for the VIP Team Learn Award. So congratulations, you deserve it.